COVID is far from over. Many public health officials are suggesting the current variant is more infectious than any COVID variant so far. As Paul Murphy reports, that has some doctors urging leaders to impose another indoor mask mandate.
Los Angeles County may soon require its 10 million residents to mask up again indoors if current COVID-19 trends continue. Children's Hospital New Orleans Chief Medical Officer Dr. Mark Kline says right now the virus is also surging in Louisiana.
I'm getting more calls, seeing more patients, hearing about more patients than ever before. This is nothing to play around with. It's making people sick. It's keeping people out of work. It's putting some people in the hospital.
The number of new cases, hospitalizations, and deaths have all ticked up across the state and in New Orleans in recent weeks.
There are a lot of people who feel really cruddy right now. This strain of COVID is not mild for many people.
The BA.5 variant is now the predominant strain here and across the country. New Orleans Health Director Dr. Jennifer Avegno says community transmission of the virus is high again.
It's certainly the most transmissible that we've seen. And again, every variant seems to have gotten more and more contagious, which is really shocking given how contagious the original variant was.
While Avegno is urging people to wear face coverings in crowded indoor settings, she says the city is far from requiring them. Dr. Kline says it would be wise to reconsider an indoor mask mandate as the numbers continue to rise.
I think it's time for hospitals to go back to mandatory masking. I'd like to see mandatory masking in other indoor spaces like restaurants and other meeting spaces.
The new variant has the ability to get around the protection offered by vaccines and prior infections. Right now, the city is averaging about 140 new COVID cases a day. Paul Murphy, Eyewitness News.
The rate of positive COVID tests in the state now stands at more than 27%. But health officials are saying that number may be deceiving because so many people are taking the home tests and not reporting the results.